Good day, ladies and gentlemen. Welcome to the second webinar of the Pre-Analytical Masterclass webinar series brought to you by the Asian and Pacific Federation for Clinical Biochemistry and Laboratory Medicine and supported by BD. First, allow me to introduce myself. My name is Nadra and I'm from BD. I'll be your moderator for today's webinar. Before kicking off the webinar, please allow me to review a few housekeeping rules for this session. The webinar will be run for an hour. Certificate links will be emailed to you upon the successful completion of the webinar. Throughout the webinar, you may ask questions via Ask the Question chat box located at the left lower corner of your screen. Questions will be addressed at the end of the presentation, and questions that were not addressed will be compiled into an FAQ sheet that will be sent to all participants. If you have any questions after the webinar, please do email them to pasea@bd.com. Before we start the webinar, I would like to invite Professor Tony Bedrick, the President of the APFCB, to give us an opening speech. Prof. Tony, please.
Thank you very much. And really, on behalf of the Asia Pacific Federation of Clinical Biochemistry and Laboratory Medicine, I'd just like to welcome everybody again to this webinar. As Nadra said, this is the second of this current series of webinars, but this is the third of these sets of webinars that we put on. So I'd like to also thank BD for their generous support of this activity, and also all our speakers who are presenting during this series and the previous series as well. It's all about trying to improve the way that we collect samples. We know, be that by phlebotomy or other sorts of samples, we know that it's probably the key area in terms of pathology of where blood samples or other sorts of samples are collected, where there's an area of error can slip in because of patient preparation or the technique used in collection or the way the sample is handled after collection, preservation, transport, etc. So it's a critical area of risk to patients. So we're very thankful that you've joined us and that you've also shown an appetite to assist in improving this key area. And I'd like to thank specifically tonight Sue Jennings, who's going to talk about competency and training and really the assessment of competency in this important area. And I think we're aware that lots of people can be trained, but then that doesn't necessarily mean that sometime after that training that they're competent. So again, it's a key area of laboratory error, pre-analytical error, and the competency of staff is the key way to reduce that error. So without any further ado, again, I'd like to thank you and BD and particularly Sue giving up her time and her expertise to pass on to you what she's learned. And please be part of this. If you have any questions whatsoever, don't hesitate in using the chat to ask your question. So thank you very much, and I'll hand over to Sue.
Thank you, Doctor. Thank you, Prof. Tony. And to kick off the webinar today, I am pleased to introduce our second speaker, Ms. Sue Jennings. Ms. Sue Jennings is an experienced phlebotomist that has worked in multiple areas of pathology collection over the last 15 years. She specialized in both routine and complex venipuncture collections on adults and children. Ms. Sue is passionate about adult education and the delivery of best practice training in the field of pathology collection, especially pertaining to pre-analytical factors which influence the production of quality samples and best diagnostic outcomes for patients. She is currently working as a training manager and RTO manager of Douglas Henley Moore Pathology DHM, which is the largest member of the Sonic Healthcare Group of practices in Australia. Here to speak on phlebotomy training and assessment and analysis of competency, please welcome Ms. Sue Jennings.
Thank you, Nadra. It's great to be here and it's great to be back for another season of these webinars, which are just fantastic that you guys put this on. I do want to have a look at a brief analysis, I guess, of training and assessment. And particularly I want to centre later on in the presentation on competency and what competency looks like or perhaps looks like, what it could look like. I'm going to start with a brief global perspective, particularly related to phlebotomy training. Then look at the Australian perspective, because that's what I kind of know best, and give you a bit of an overview of how we tackle and manage these issues of training and assessment here at Douglas Hanly Moir Pathology. And I'll finish with some ideas and resources, I guess, on assessing competency. So in terms of a global perspective, I just want to start right from the outset of saying that I'm definitely not an expert on what's happening around the world. And much of my global perspective has been fed from talking to other people and doing Google searches, which is not always that reliable. But rather than centering on the specifics of courses and things like that, I want to just get an idea of some of the common themes and trends in phlebotomy training, because I think it just helps to give us an idea of course content, what constitutes appropriate training for phlebotomists. In terms of starting, we start with the USA. This was actually one of the hardest to research because, as you can see from my next slide when I get there, there are at least 13 different certifications that I could find relating to phlebotomy training. So it was difficult to find, a sense of consistency and how the regulations and standards fed into the different courses. But I guess some of the characteristics for the prerequisites included that they already had to have a high school diploma, they had to complete some phlebotomy training, a program, and they had to show proof of a minimum of 30 vena punches and 10 capillary collections. And I think as we move forward, you'll start to see some commonality in some of these sort of frameworks that are there. In terms of our next country, Singapore, I must admit it was easier to find some content about what happens in Singapore, and there's some experts in BD from Singapore who probably know this stuff better than I do. But there seem to be a few major organisations who offer phlebotomy training, one being Tamask Polytechnic, and applicants had to be employed as current phlebotomists or trainee phlebotomists in an organisation. And it seemed to be the entry level kind of course for healthcare workers. It was a structured program with assessment criteria built into it. A theory assessment was held 2 weeks after the course content. And participants had to get 75% attendance. They had to satisfactorily complete at least 50 phlebotomies. So USA, 30 phlebotomies, 50 in this course. So we're getting, some consistency there. And they had to be able to show that they could perform those collections independently in their own organisation, pass the theory, and then they were awarded a certificate in phlebotomy. And you can start to see some of the content on this slide: safety, anatomy and physiology, including urine and body fluids, specimen collections, pre-analytical variables, which of course we dealt a lot with in our last series, skin punches, quality assurance, infection control. So some really key components in what should or what could be in a really good training program. Very similar to the last one, Republic Polytechnic, at the Academy of Continuing Education. That seemed to be quite similar in the course structure and content. There was a theory component, and participants had to pass that theory before they could proceed to the practical component. And then they had to pass the practical component to get their certificate. Again, they had to show 50 verified successful live draws, blood draws, and it had to be completed within a month of their practical placement. And then, this was interesting, they had to perform a live draw to a panel of assessors. Here at DHM, we certainly do assess our staff, and they have to be able to show us that they can perform that in front of our assessors. I don't know about a panel of assessors. That sounds a bit scary to me, but certainly I guess it's a way of assessing competence. And at the end of it, participants are awarded their certificate of completion. And again, we have that 75% course attendance, which is interesting. Seems to be standard across what I can read in Singapore. They have to have passed their written and practical components, and then they're eligible for their certificate. And if you look at the slide, we can see common themes: anatomy and physiology, medical terminology, the role of the phlebotomist, which aren't in all courses, which is interesting. I think it's a very important component. I'll deal with that later. Patient identification, skin puncture and venipuncture, being able to troubleshoot, patient care, another important component. So it's good to see that in there. Safety precautions, and I'm assuming that also would include a little bit of infection prevention and safety and pre-analytical variables. And then there was a course which I found, Specialised Diploma in Phlebotomy Management Services, which was a 12-month duration course, and this seemed to be the only one that, certainly the only one that advertised that you could be registered with a regulatory body. It included things like introduction to phlebotomy, clinical laboratory, legal issues, anatomy and physiology, medical terminology, techniques and procedures, safety, again, coming in there, post-procedure complications. So seems quite advanced, but also common themes that we're seeing in the 12-month duration. And I think that's important to note, because some of the other courses have been short courses. This is obviously something more formal and over a longer period of time, and probably much in line with what is happening in Australia. India also included a hands-on and a theory component. It was a 6-month program. It was a structured program, covered very similar topics as in Singapore and Australian courses. There was no mention of assessment requirements, so it was hard to understand what was involved in terms of practical assessments and how many they would need to do. But they commonly referred to the collection staff as phlebotomy technicians. So just some slight changes in terminology. In the United Kingdom, they also have quite a structured program. They do some what they call abstract learning, which was like online learning, and then did a practical component. And this course, they have a basic course and an advanced course, and there were no prerequisites, so you didn't have to have a previous qualification to enter into this course. Some of the content was very similar, I must admit. So venipuncture process, labelling, safety protocols, prioritising patient care. So again, some of those topics, infection control. And in the advanced one, and I thought I'd put this one up, they went more into professional attributes of phlebotomists, some of the obligations and the core roles, code of conduct. So we're starting to see some of those personal attributes coming in. Drawing blood, how to know the right procedure, preserving blood samples. And the Philippines, which I think this might be our last brief look across the world. Again, they offered a certificate course, and on completion, you got a certificate and an ID card that you could use. The course was accredited by a number of bodies based in different countries. It's interesting that it seemed to be that capillary sampling and ABGs were included in the course, even though it was a short course, whereas in Australia that isn't always done in the initial training. It's sometimes done as more advanced training. But when I looked at the course content, similar things, the blood system procedures, legalities, infection control, anatomy and physiology, going through the blood collection procedure, analyticals like order of draw, and roles and responsibilities of phlebotomists. Now, I then went and looked and I thought, well, maybe I'd like to see what the World Health Organization said about phlebotomy and best practices. And they wrote a guideline back in 2010. It's quite some time ago now. And there, as far as I can tell from WHO, there hasn't been an update since then. But their recommendation is that before undertaking phlebotomy, health workers should be trained in, so we're establishing that some sort of training should exist, but also that they should demonstrate proficiency for, and that's an interesting word, demonstrate proficiency. How do we do that? How do we maintain that is a good question, and we'll look into that as we go. And I think the other thing to highlight is that it needs to be within their scope of practice, which is about working within your boundaries. And we've talked about that previously on these webinars. I think it's a very important thing that we understand what our scope of practice is and we don't work outside that scope of practice. The outcome of the course should be safety of the patients, adequacy of the laboratory specimens, so producing good quality samples, and the safety and health of the health workers and the community. I then compared what WHO kind of outlined, because they have an appendix where they talk about what should be in their course, and I compared that with CLSI, which is the Clinical Laboratory Standards Institute, of course, coming from the USA. And I thought it was just interesting to do a comparison and to see some of the course content that they both recommend should be in a training program. Anatomy and physiology, infection prevention and control, and you'll see some overlaps here. I'm not going to go through all of them. I guess just you can visually see the content. A lot of it, there are some similarities. I think CSLIs give a more extended list of what they think should be included in good phlebotomy courses. And it's interesting that they mention that there should be assessments and that there should be initial and periodic. There should be continuing education and continuing assessments. And I'm particularly going to look at that as we move forward in this presentation. You can see some consistencies on some of the must-haves, infection control, understanding the healthcare system, medical terminology, patient identification and issues around that, labelling, managing complications of venipuncture, legal issues. It's probably the ones that I wanted to really point out: safety, health and safety in all fields. And I think too that knowledge of the laboratory, having a basic understanding of laboratory requirements and what laboratories require of us as collectors is important. Now, I think CLSI is probably quite close and very similar in terms of content and some of the terms that are used to the Australian market and what happens here in Australia. Australia has a nationally recognised qualification. It's called a Certificate 3 in Pathology Collection. And I just briefly want to highlight what that qualification involves. So give you a perspective of what happens here in Australia. Now, to lead into this, there was a research paper done in 2013 here in Australia by Pilbeam Badrick, our own Tony Badrick, who you heard earlier, and Rideout. And they did a collation, an investigation, a report where they interviewed lots of different organisations and industry organisations across the board in the realm of pathology, and they made some recommendations for the Department of Health. And the aim of the report was to investigate and make recommendations about best practice phlebotomy. And I just picked out some of the key recommendations, but probably the biggest one was that that we aimed towards developing competent pathology collectors who hold a national qualification, and that being Certificate 3 in Pathology Collection. So rather than, because you certainly can in Australia do a short course. You can do a one-day course in taking blood, but it's not recognised. They're not recognised courses. You probably wouldn't get employed in most organisations based on that kind of a course. So there's a recognised national standard now for pathology collectors or phlebotomists, and that is this Certificate 3 in Pathology Collection. One of the other recommendations, key recommendations, was that staff should have annual assessments and ongoing assessments. And I think that that is crucial, that we don't just establish competency once, that we have to continually prove and maintain competency and demonstrate it. So we'll unpackage that a little bit more too. And that all organisations should have a documented policy and procedure manual as part of their quality systems or their program. You have to have systems and policies that you can, or criteria that you can assess against. And some of that is industry-led, some of that is work-based, but all staff need to have policy and procedures that are maintained for the protection of patients and for the protection of the collectors themselves. So this is what the Certificate 3 in Pathology Collection looks like in Australia. There are 9 core units that you have to do, and each one of those listed there on the slide is an individual unit of competency that you must achieve to get this Certificate 3 in Pathology. It's the standard course across the whole of Australia. One thing to point out is that in Australia we refer to pathologists as pathology collectors, and I think they've adopted that term just to highlight that it's more than just venipuncture, that we're performing non-blood samples. Usually in most phlebotomy organisations they would also be doing things like ECGs, Holter monitoring and blood pressure monitoring. So there's some core units there working with in the community. So there's some patient-centred units, delivering customer service, working with diverse people. There's a unit around infection prevention and control, identifying clinical risks. Of course, the key unit there is perform venous blood collections, but also collecting pathology specimens other than blood. So all those non-blood samples that we collect. Work health and safety, and another classic that we saw in most other courses around the world, and that's being able to interpret and apply medical terminology, particularly in relation to pathology collection. As well as the 9 core units, you have to have 5 elective units. So there's 14 units altogether that make up the certificate. So at DHM, those ones in red are the electives that we've chosen to do, because it's based on our job role and what our requirements are here at DHM. So we do a unit called Receive, Prepare and Dispatch pathology specimens, mainly about, does it need freezing? Does it need to be at the laboratory urgently? How are we going to transport it? Do we have to spin it first? All of that sort of things. First aid, ECGs, Holter monitoring, and we have this unit on visiting client residents. And that's because in Australia, or particularly at DHM, we do a lot of house calls to patients who are infirm and can't get out of the home or into nursing homes and hospitals. So we use that unit to cover that. And we also do 2 other units as really standalone courses, standalone units, and that's perform capillary blood collections and collect specimens for drugs of abuse testing. Now, you might ask why they're not core units, and really it's because it's been tapered to the industry and industry requirements, and not all organisations would require you to do urinary drug screening or even capillary collections. So it just allows that flexibility for people to describe what they would want or, to include what they would need to. Now, each unit in the Certificate 3 in Pathology then has a whole lot of elements and performance criteria that have to be met in order to get that unit. So this on the screen is the performance, the elements that are required for the Perform Blood Collections unit. And as you can see, it's broken down into elements. So greet the client and confirm the pre-test criteria. And then it has a whole lot of performance criteria that has to be met by the trainee or the person who's going for this qualification in order to be deemed competent in that unit of competency. The second element is prepare for venous blood collections. So that's all about getting yourself set up, assembling your equipment, making sure that the patient's positioned properly, seeking assistance if you need to. So you can see they spell out very clearly what is involved in obtaining competency in this unit. It then goes on to draw blood as the third unit, and that's the actual blood taking. And again, it outlines core components which must be demonstrated. So you have to be able to adapt standard and additional infection control guidelines. You have to clean the site. You have to apply and loosen the tourniquet according to the requirements of the equipment being used. You have to confirm a suitable vein through palpation. So it gives very specific guidelines on what must be included, both in training and assessing. So these units, it's important to know that you have to both demonstrate that you train it and also that you assess it. And then the last unit there, the last element is follow post-blood collection procedures. So that's like aftercare, caring for the patient, giving post-care instructions, attending to the site, making sure it's not bleeding, labelling your tubes, confirming those labelling requirements with the patient. So again, highlights very specific elements that must be present to show competency. Then the unit is broken up to, that just outlines the unit content, and then it tells you what the assessment components involve. So in this particular unit of competency, perform blood collection, remembering that this is just one unit out of 14 units, it gives very specific assessment criteria, and in particular that they can perform all of those assessment performance criteria during a period of at least 35 hours of pathology collection work. So they have to work in a live setting, and you must be supervised by somebody who's also working in phlebotomy for at least 18 hours a fortnight. So that's, I guess, was to guard against people saying, oh, yeah, you're okay. So had to be somebody who was at least working in pathology who could supervise you if you were doing any collections. You have to show that you followed established technical, infection control and safety procedures, and that you collected blood suitable for testing using venous blood collection with a maximum of 2 attempts from at least 20 different people comprising adults and of varied ages. So you can't just go in and bleed 5 friends who've got great big veins. You have to show that you can do it over a period of 20 different people and from a variety of ages and situations. You have to also show that you could use the evacuated system at least 10 times, and then a combination of either evacuated or wind infusion sets and or needle and syringe, depending on your organisation policies and procedures. So it outlines very specifically what the assessment components require. I mean, it's interesting that we only require 20 collections, but you know, in other countries you saw 30 and 50, which I kind of like the look of myself. And then you have to also assess knowledge. So then it highlights what's the knowledge component of the course. And again, it highlights a whole range of things, legal and ethical considerations. And under those legal and ethical considerations, it has things like duty of care, informed consent, mandatory reporting if you think somebody's being abused in the workplace, your work role boundaries, blood collections in different contexts. So all of those things form the knowledge components, and you have to be able to show that you are assessing this as well. You have to assess the knowledge component of standard infection control, so hand hygiene, PPE, all of that, waste disposal. Industry terminology used in blood collections. So, yeah, again, you have to show that you could demonstrate how you assess that in the workplace. Key aspects of anatomy and physiology in relation to vascular, arterial and nervous system. Components of blood, so serum, plasma, red cells, white cells, platelets. Clinical risks. Collection procedure factors which contribute to quality sample collection, pre-analytical factors, and it has to include things, appropriate times to collect, impact of drugs, timing of the last dose, and required fasting time. So anything listed in those knowledge components must be present in your training and in your assessing. Features, functions and use of venipuncture equipment, highlights the different things. Blood sample handling process, transit and storage methods, and requirements for selection and collection into tubes with variable additives. So they need to understand different tubes and the additives of those tubes. Now, the assessment conditions. So they have at least 5 of the 20 collections must be directly observed in the workplace by an assessor. And in this case, an assessor is somebody who actually holds a certificate for in training and assessment. So it can't just be the phlebotomist who they've been, who's been supervising them. At least 5 of the collections must be officially assessed by a qualified assessor. So how does DHM tackle this? Remembering that that's just one unit and we have to cover 14 units with the same sort of criteria that have components that you have to cover. Then they have the assessment components, which include knowledge and the skills. So we run our course over 18 to 24 months part-time or 12 months full-time. And we do that through a series of classroom sessions, lectures. We do simulated practical sessions in the clinic. And we do that before they even go out into the live setting. Then they go and get some work experience in a live clinical setting, so in our collection centres, working alongside, we have designated trainers who have done a course and we've specifically trained to work with them in the workplace. So even though the standard, the qualification itself says that it just needs to be somebody working in, as a phlebotomist for 18 hours is the ruling. We've decided that we want actual workplace trainers who we've specifically trained for this role. So every new trainee gets put with a designated trainer to work alongside them to develop their skills in the workplace. We also do some self-directed learning, so we give them some logbooks and workbooks that they work on while they're in that clinical setting. And they have some online learning. So some of our units we cover off, particularly things like legal issues and medical terminology, we cover off on an e-learning, an online learning platform. And every single trainee that we have, who are also our employers because we are what's called an enterprise RTO, means that we train our own staff through this in Certificate 3 in pathology. But every trainee is given direct and indirect supervision by either a training officer or a designated trainer in the workplace. Designated trainer, basically you could call them workplace trainers, same term. So in terms of an overview of the types of assessments that we do, they have a logbook that they do in the first 6 weeks of their training. And that logbook not only logs all their collections, so every collection, so they do 4 weeks of collecting where they log how many collections they're doing, whether they needed help or support while they do those collections, and if so, what type of support, so that we can start to see as assessors and as trainers where there might be gaps in their learning. So things like, needed assistance to loosen the tourniquet, or needed help with their venipuncture technique, or needed assistance because they didn't get the blood, needed help changing tubes, whatever it is in those early stages, so that we can start to see patterns of how they're progressing and how their skill development is progressing. They also have questions that they have to answer every day, so short answer questions in their logbook pertaining to venipuncture. So it might be things like, what are the most common veins that should be used for a routine venipuncture, naming the blood cells, things like that. Some of the theory elements we cover off in their logbooks. Then they get a logbook 2, and that covers them off from weeks 7 to 48. So remembering we're doing this course over 12 months full-time and part-time a bit longer, but from week 7 to 48, they're starting to develop more advanced collections, really, and hopefully their skill development is progressing through that time. They also record some of their more advanced procedures. They might be doing younger children from 15 down to 6. We usually get them to stop at in their first 12 months. And also doing some questions in those logbooks. They have a cardiology logbook to log all their ECGs, Holters and BPs in that time as well. And they do a specific infection prevention workbook because it covers all aspects of the job role. We assess all our new staff, our new trainees, at week 6, at week 12, at 5 months and 11 months. And that's to show the ongoing progression. So you don't just do it once and say, oh, yeah, you're competent because you did 5 collections. They need to be able to reproduce that. And we would see, we would expect to see a progression in their skill development. So in week 6, they might just do very routine collections, good, strong, healthy patients with good veins. By week 12, they should be starting to do some, patients that their veins aren't as obvious. By 5 months and 11 months, we would expect that they could manage most scenarios. There might be some times when they would miss or that it would be beyond them, but they should be starting to certainly be able to work independently, that they should be able to manage most collections on their own and also troubleshoot. So some of that more complex skill development. The online learning modules are listed there, visiting clients in their homes, medical terminology, working with diverse people, law and ethics. They're covered off in online learning modules. So that's basically the course breakdown and the course content of how we kind of manage that. In terms of moving people forward, they start at that base level where they do down at the bottom there. I guess the idea is we're trying to move them from a brand new learner to a competent collector. And the way we go about that is we start with 2 weeks of classroom, mainly theory, but also practice, simulated practice in a classroom environment until they're deemed safe to work in a live environment. And again, they're being assessed by a qualified assessor at that stage. Then they move into the live environment where they're given on-the-job training and they meet some milestones. So they have their assessments that we just talked about. And then finally we do a final sign-off. They have some final assessments, theory, practical components that are tied in throughout the process. And we say, yes, they're competent, and we issue them a Certificate 3 in pathology. Now, it's probably a good time to ask, well, what is competency? Quite a good definition is that it's the knowledge, the skills, and the behavioural attributes. And I think that's an important one to emphasise. It's not just that I can, get a tube of blood and send it off to the laboratory. It's that I, have that comprehensive knowledge about the job role, that I have a variety of skills that go along with that, but I also have the attributes, the personal qualities that make a good collector, that gives good patient care, good patient outcomes, that, I follow company protocols because I'm reliable, I'm honest, I turn up to work on time, those sorts of things that are acceptable and necessary for job performance. The way we manage competency, I guess, is that you have to have some standards or criteria that you measure the competency by. So if you want somebody to be a good collector, you must have the steps listed that you want them to achieve. So they can be work-based or they can be industry-based. And now in Australia, the Certificate 3 in pathology kind of sets that for you, because it says, you have to meet these criteria in order to be competent. And every RTO, Registered Training Organisation, has to build that into their course about how they're going to do it. So you have to have some standards or criteria that you measure people against. Then you need to have an assessment tool to capture that information. So you have to assess against those standards or against those criteria. You can't just say to, have it very loose on a piece of paper and say, oh, yeah, you're competent because you got the needle in and, you need to have a specific set of criteria, and it has to be the same for every individual, so it's consistent across the board. You need to have some qualified assessors. Who is going to assess competency? You can't assess competency if you're not competent yourself. So you have to be at least somebody who's a senior trainer, senior collector, somebody who's been deemed to be competent, to follow the standards, to follow, the routine, the protocols, policies, have good collection skills. So it needs to be, if you're going to assess competency, then you have to be a competent person yourself. And that will be different in different, parts of the world. In Australia, generally that's somebody who holds a certificate 4 in training and assessment. But as a minimum, it needs to be somebody working in the field who has already been assessed as being competent themselves and also maintains their own currency, and somebody who understands the assessment criteria. Then you need a process of recording that competency, a process whereby you can show that they've met the competency. It could be a student management system, a spreadsheet, paper files. It can be anything, but we need some way where we can record the competency and also know when they would be due for their next competency. So you don't have people who, 3 years down the track, you go, I forgot to do their assessment, or they haven't had an assessment recently. So you need a way of maintaining records of competency. And then you need some sort of formal system or loop. What are you going to do if they're not competent? How do you identify the gaps? Do you offer retraining and reassess? And that is generally seen as the gold standard, is that if somebody's not yet competent, which is the term we use in Australia, we would go about working and identifying what are their gaps, their learning gaps. We would give them retraining and then would reassess. Then once somebody is deemed competent, then it's about they need to maintain that competency. So at DHM, all staff, all collection staff, whether you are a supervisor right down to a brand new trainee, have yearly assessments. And we also offer refresher training for those. So if the yearly assessment we find gaps, and sometimes you do, and sometimes it's on experienced staff who have been with us for a long time, who've over time developed bad habits, and we can capture them in those yearly assessments, offer some refresher training and reassess, and hopefully then, where you can say, yes, we're confident with their competency. Just some, I guess, rules, I think, around competency-based assessment. And these are just off the top of my head from experience of working in the field. Another nice little definition is the competency-based assessment is the gathering and judging of evidence in order to decide whether a person has achieved a standard of competence. And some of the guidelines around that is that it has to be a consistent set of criteria for all people. You can't make exceptions. You can't say, oh, I'll assess this person this way because I like them, but, you know, this person I'm going to be a bit harder on. You assess against the criteria for all people. They have to show transferable skills, so they have to do it across a variety of situations, ages and genders. They can't just bleed 5 good, healthy men with, you know, big veins in the cubital fossa. They need to be able to demonstrate that they can do it again and again across a variety of situations. You need to assess skills, knowledge and attributes, personal qualities. How do they greet the patient? How do they behave in the workplace? It has to be demonstrated in real life, so not just simulated. It's not enough just to do it on a rubber arm or, you know, in a practice lab. They have to be able to demonstrate those skills in real life situations. It has to be replicated over a period of time, so not just once, so ongoing competency. It has to meet industry standards or company protocols. So if you don't have industry standards, you would definitely have your own company protocols or procedures that you have to meet. So they kind of help form some of your criteria, I guess. But it definitely has to comply with any industry standards or company standards. You have to provide feedback on performance and areas of development to your learner. So it's not enough just to assess and move on. You have to give them feedback about how they're going, how they're progressing, and if there's any areas that they could work on or develop and improve their skills. Any good competency-based assessment must provide for ongoing training, so any additional training and reassessment, so it's not, oh, you failed, off you go. You know, being able to give further training and then to reassess. Usually here we would put them back with their workplace trainer for anywhere from 2 to 4 weeks, see if they can address the gaps, and then we would do a reassessment. Competency has to be maintained. You have to show ongoing competency, and yearly is probably a good benchmark. That's how we do it at DHM. And it has to follow rules or principles of assessment. So things like it has to be fair. It has to show some flexibility. If they've come to work and they've got a blinding headache or migraine, or they've had a death in the family, probably not a good idea to assess them that day. So there has to be some flexibility around assessment. They have to be valid assessments, so using a proper assessment tool. They need to be reliable. So reliability means, you know, they have to assess against core standards that they you can trust the person who's done it because they've got the skills and the qualifications, that you can trust the data because you've got a good assessment tool that captures the right information. They have to be authentic, you have to have sufficient evidence, and it has to be current. So there's some of the rules or principles of assessment that are set out in Australia that around assessment tools and how you assess an individual. I know this is a quick run through, but hopefully it's giving you some ideas of how you might go about maintaining currency in your staff and assessing currency. I just wanted to quickly put this up. This is just one example of a million examples that you could find of assessment tools. This is just one on pathology specimen collection for venipuncture. And I know it's probably a little bit difficult to see, but, has the individual's name that you're assessing, the date that you assess, so it has to have some validity to it. And then it captures some personal attributes in the first part that asks the assessor to comment on, how are they following policies and procedures? Are they dressed appropriately? Are they communicating with patients appropriately? And so that's some of those core qualities at the beginning of the assessment. But then it goes on to list the assessment criteria. And you can see those columns 1 to 5 that they're assessed over 5 collections on this particular assessment. They have to do 5 collections. And there's a whole lot of competencies that they have to show that they meet. Oh, sorry, I better move the slider. And then at the bottom, they have to put, some parameters around the patient so we can see that they've done different people, males, females, different ages, and you have a whole list of criteria that you need to meet, which is essentially looking at this particular assessment, a venipuncture assessment. The process is broken up into steps. So it can be as simple as your procedure being broken down and then having a scale that you assess them by. This particular assessment uses A, B, C, D. A means that they could do it by themselves. B meant that they needed some assistance. C meaning that they needed intervention. Oh, no, B means that they needed prompting. C, they needed some assistance. And D was that they actually couldn't perform that element themselves at all. They needed full guidance. So that's just an example of what a tool, one assessment tool might be, and it would be one of many that you also have, would have other tools that you would assess, but that just gives you some examples. Some useful websites that I found, and particularly I really liked the second one, the Phlebotomy Workbook online version. Actually was quite a useful assessment tool. If you're looking for somewhere to start, those top 2 had some really good ideas of just really simple tools to capture competency. So take a look at those. It might get you started in terms of if you're looking at ways to find some appropriate tools. I also put in the training.gov.au and the HLPTA, that PAT002, that's that perform blood collection component that we looked at, the unit of competency. And I just thought you might like to look at that in greater detail as to what is captured in the venipuncture unit of competency, the type of evidence that they're looking for, the course content that they're looking for. Again, if you're needing to look at your own training programs, there might be some really good ideas in there of what you could include in your own training program. I really hope that some of that's been useful to you. Assessing competence is an ongoing, beast. I want to say beast because it never ends. You have to keep refining your processes. There's always more, best practice. There's always new innovations that you need to look at and consider in your training. We're moving into a more automated world where that will change the way we train and assess even more. So it's about a constant process of having a framework that you work with, that it incorporates what is best practice, that you have a structured program that targets those skills, knowledge and attributes that you want to make up your training course. And hopefully in the end, we end up with a competent workforce that is producing good quality samples. Staff that we can trust to do the right things, staff who have got really good skills and a sound knowledge of what they're doing. And that's really what we're aiming for, so that we have better patient outcomes and better laboratory outcomes in terms of the types of samples that we are producing. So thank you for this opportunity to share a little bit about what we do here at DHM. And I look forward to any further discussions on this topic. So thank you.
Thank you very much, Ms. Sue, for the very informative and detailed sharing. However, due to the time constraint, I think we can at least take one question, which I think is quite relatable to most of the people here. So one of the questions we receive is, what happened or what can we do even after repeated training and the staff actually still have a lot of, sample rejections or doesn't have that confidence in blood collection? How do we overcome that?
Yeah, that's a great question. I guess I could answer that in a couple of ways. There are sub-staff, unfortunately, no matter how much training we give them, maybe not suited for the role. And that's just a reality that you might need to address. And so then that might be about looking at other options. Is there other job roles that we can channel them into? So here we have what we call a pathology assistant. They do everything else that a pathology collector does except take blood. So they still do ECGs, non-bloods, and we would channel them into that job role. Maybe a laboratory position, maybe a reception position. So that's one kind of answer. But there's some people who actually, no matter how much training, maybe they're not suited. There are other people, though, that if you target the specific areas that they're having trouble with repeatedly and give them somebody who works alongside them, prompting them and supporting them, over a period of time, maybe 1-2 weeks of intensive training, sometimes you can actually change those behaviours and get them over the line. And then sometimes they're just disciplinary issues. They can do it, but they choose not to. And then that becomes a performance management issue where, management might need to get involved in performance managing that person. So that's a short answer question to a very complex question.
Yeah, thank you, Sue, for addressing that question. I do agree with you. I think, for phlebotomies, for blood collection in general, sometimes, we need to kind of keep doing it in order to get that momentum as well. So I do agree in that with the questions that the answer that you actually address. So unfortunately, we actually need to conclude this webinar shortly because of the time constraint, but rest assured that any questions you have will be addressed via an FAQ that will be emailed to all the participants. Please do take a moment to complete the feedback on this session that will be launched at the end of this webinar. Once you have completed the feedback, ensure to click Submit at the end of the page to receive a certificate link that will be emailed to your registered email. Once again, thank you so much, Ms. Sue, for your lovely presentation, and thank you everyone for making the time to attend this session. We hope you enjoyed this presentation and look forward to seeing you next webinar on the 6th of November.